As a diabetic, what do you need to know before considering intermittent fasting? I'll review the top 7 tips for you in today's episode, coming up. If it's your first time here, I'm Dr. Majd. Consider subscribing to this channel for up-to-date medical topics, news, and headlines. Now, I've previously reviewed why intermittent fasting works, how to get started, and the rules, and the top 5 questions that I've received from patients and viewers on intermittent fasting. If you want to check those out after this video and you want to learn more, I'll place links down in the description box. First of all, if you're a diabetic and considering intermittent fasting, you should always consult your doctor and review your medications and your fasting plan details before you initiate it. I mean, this goes for everyone, but especially for those with diabetes and especially for diabetics on medications. It's simply for general informational purposes, and everyone may be different. And if you have a history of an eating disorder or have those tendencies, intermittent fasting is not for you. I just want to make that very clear because it can trigger the same thought and behavior patterns. So just don't go there. It's not worth it. All right, so for everyone else, here we go. Tip number 1, diabetics may need to be more patient with intermittent fasting, or they may require more stringent intermittent fasting versions initially. So the longer you've been overweight or the more severe the diabetes, the longer it may take to down-regulate your insulin levels. So if you start with the 16-8, it may take a little longer for it to kick in than, let's say, your neighbor or your friend who doesn't have diabetes or hasn't been overweight for very long. If you want to speed it up, you can extend the fasting times from 16 hours to either 18, which means you'll have a 6-hour eating window, or 20, which means you'll have a 4-hour eating window, or even 24 hours. Now remember, 24 hours means 1 meal a day, not 0 meals. So if you select the 24-hour option, you may want to do this every other day and not daily. Now, once you've reached your goal weight, you can actually back off and simply do a 16-8 several times a week. Everyone's different though, so you'll have to keep a close eye on your weight along with your doctor as you change your fasting plans along the way. Tip number 2, if you're taking certain medications like sulfonylureas, like glipizide or glyburide, which are 2 examples of the most common generics in this group, or if you're taking insulin or other medications that actually decrease your blood glucose levels, you need to take extra hypoglycemic precautions because your blood glucose levels may dip, especially during fasting. Hypoglycemia can cause sudden onset of shaking, sweating, weakness, etc. It can land people in the hospital, and it can even be life-threatening. Most people who have experienced it once know what it tends to feel like. So carry glucose tablets, which are over the counter, everywhere you go in case you experience one of these episodes, and make sure to report it to your doctor. Now, if you're taking these medications multiple times a day, you should also ask your doctor when the best time to take it would be before you decide to initiate fasting. For instance, if you're on the 16-8 schedule, some twice daily medications may be taken with your 2 meals during the 8 hours instead of having to take one of them during the fasting hours and the other one during the eating window. But of course, you must run it through your doctor first. Tip number 3, you may require more frequent doctor's visits, like every 1 to 2 weeks, to tweak your medications as you lose weight. Note, this may include other medications besides the ones for blood glucose, such as like the treatment that you may be taking for high blood pressure. Your blood pressure may decrease with weight loss, so be careful. Check your blood sugar levels 3 to 4 times daily, and also when you don't feel good. Write them down and then bring your blood glucose log and your blood pressure log with you to your doctor's visits. Tip number 4, if you're only on metformin and that's it. Metformin is a generic drug that decreases glucose production in the liver and doesn't tend to cause hypoglycemic episodes in most people like other diabetes medicines do. You still need to consult your doctor before initiating intermittent fasting, however, because it may increase gastrointestinal side effects like stomach upset and diarrhea if taken without food in some people. Like I mentioned prior, you can ask your doctor if you can take it during the eating hours if you're taking it twice a day and you're on the 16-8. So if you're on the 16-8 and you're having lunch and dinner, you may possibly be able to take one at lunch and one at dinner after you speak with your doctor. But there's also extended release daily versions if that doesn't work out either. And sometimes the GI side effects are a little bit less in those. Another option to discuss with your doctor if the timing cannot be changed is to simply take it with some leafy greens as last resort. Tip number 5, you will still have to watch the carbs during your eating window. I'm sorry. There's no way around that. You cannot simply eat what you want as a diabetic. Try to follow the tips in my handout on the do's and don'ts of the eating window. I'll place a link to my handout in the description down below. And maintain a balanced diet during your eating hours. Tip number 6, keep close contact with your doctor. If getting frequent hypoglycemic episodes, don't wait 2 weeks for your appointment to tell your doctor. Same goes for if your blood glucose levels spike above your typical baseline, if your medications were adjusted or decreased during this entire process. You need to let them know and communicate with your doctor to let them know what's going on. Lastly, if your doctor doesn't feel comfortable managing your diabetes while on intermittent fasting, which is completely understandable, given us doctors, we don't have a lot of guidelines right now on how to go about this, especially with diabetics, since there aren't a lot of studies, then you can consider asking for a referral to an endocrinologist who specifically may be more familiar with intermittent fasting and diabetics. Now, intermittent fasting and diabetics can be done, but it just takes a highly motivated diabetic who can maintain great structure and close ties with your doctor during this time period. Hopefully you like your doctor because you'll be seeing her or him more frequently for a while. If you found the information valuable, which is always my goal, please subscribe, ring the bell, like, and consider sharing it with someone else who may find this video useful. Well, thanks for tuning in. Stay nutritious, healthy, and I'll catch you next time.